Hi, I'm Dr. Keshishian, and welcome to our podcast series, PPE, Podcast for Psychoeducation, during the COVID-19 pandemic. Today, we're discussing the stress you might be feeling if you have recently developed diabetes during pregnancy, which is also known as gestational diabetes. I'm joined by Dr. Sequeira from endocrinology. Hi, Dr. Sequeira.
Yes.
Hi.
Hi. Hi.
And also Dr. Pine from psychiatry. Hi, Dr. Pine.
Hi.
Thank you both for being here. We will be discussing gestational diabetes and some common emotional responses patients can feel if they have developed this diagnosis. We'll also be discussing living through the pandemic and how these emotions can be heightened, and some strategies to help process and cope with those feelings to help you get through this journey. So Dr. Sequeira, maybe you can tell us a little bit about what you have been experiencing when talking to your patients who have just developed gestational diabetes.
So I think in our patient population, we have a lot of patients that get very nervous because of the minute they hear diabetes, or they automatically think of what the worst case scenario, and especially in our patient population when there's a lot of diabetes, just regular diabetes, that when we have when someone gets diagnosed, their concern is what did they do? Two, what's going to happen to them? And especially when they're pregnant, what we're going to do to hurt the baby, because we need to do something to improve their glycemic control. So I think right now, the usual fears of like, what happened? Why did I do? What did someone do? Or is there, but then on top of it, with what's going on right now, the fears are, it's just going to make things worse for me now, because now I have to come in more often, or I don't have enough food. I don't have, my family's like very stressed. Now people are losing their jobs. We're eating what we can, and you're asking me to diet,
Mm-hmm.
So very, it's difficult when you're trying to advise staying healthy, exercise when you're in a quarantine.
So it sounds like you're saying baseline, regardless of the pandemic, patients would feel stressed out getting this diagnosis, just period. But now we've added multiple complications to the situation.
Absolutely.
So Dr. Pine, what might you think are some of the emotional challenges people might be going through?
Well, I think it's depressing. I think especially for most young women who are getting gestational diabetes, they, previously felt like they were a healthy person, and it's not, it has to change how you look at yourself, even though it's gestational diabetes, and you probably won't have diabetes when you're not pregnant. But there's a lot of anger too, like, why did this have to happen to me right now? And people have a lot of guilt and shame about it. They feel like they got the gestational diabetes because they did something wrong. And here you did something wrong, and it might have harmful effects on the baby. So there's a lot of uncomfortable feelings that come up that sometimes also raise a lot of anxiety and hopefully don't interfere with taking care of the gestational diabetes and the pregnancy as a whole.
Yeah, Dr. Sequeira, in regards to the guilt, I think that could be something many patients would feel, especially because you're talking about developing diabetes during pregnancy and not necessarily having diabetes beforehand. What kind of experiences have you had with that?
Yeah, I think, again, at baseline, just developing diabetes is a very worrisome diagnosis for many. Many feel guilty, like, what did they do why did they do to cause this? And so we have to keep, I usually, when I approach it, I don't tell them it's like they've done this to make themselves the problem. I try to explain that, when you're pregnant, you're making different hormones that put you more susceptible to your body different needs. And if that adding different medications, insulin, what we need to do is to do the best for the mom and the baby. Not to necessarily, it's not necessarily like a failure of the diagnosis, but more like, this is just another experience that can happen during pregnancy to be aware of, and that we need to address to make sure that everybody's safe and healthy. So, but it's very hard because, again, they've heard so many stories of like what can happen to patients with diabetes that are not diabetes. So their worries are heightened. And then on top of it, they're worried about what this will mean for their unborn baby.
Right.
So they become, there's a lot of skepticism, a lot of worry, like, are you sure this is okay for me? They listen. The reality is our patient population listen to their comadres, their their aunts, all of the family structure and sometimes kind of the doctor recommendations at the very end because of all their worries and of all the stories that they've heard, sometimes by like direct experience, sometimes just by like, I heard this person did this, and that alone is can drive their care significantly and not necessarily for the better.
And, the other problem right now with gestational diabetes is that, like I said, these people, the women who develop it were not necessarily people who had a lot of medical problems before, but now they have a medical problem, serious medical problem. And then they realize that they're in a high risk group as far as COVID. And it makes the worry more because you can say, okay, I'm 25 years old. It's not dangerous to get this disease. But if you're 25 years old and you're in a high risk group, who knows what might happen? And it's like you were saying, it's scary to think of going into the hospital, which might lead people to not keep their prenatal appointments, which are even more important now because you really need to see how the diabetes is going along with pregnancy.
Yeah. And then I think even for myself, like now you have an extra burden of daycare and being a teacher as well. So you have these women that are pregnant now instead of having their children that are going to school, staying at home. And so then they're like, I can't go to my appointment because I have 3 kids and otherwise I can't take them to my visit. And, the regulations have become very strict now to try to, prevent and the spread. So even just going to an appointment is like limited to like, you can only bring yourself, no one else. So it's definitely added extra level of stress and of having to make some adjustments.
So it sounds like we touched upon a lot of different things. We have this fear and uncertainty already of developing a disease you might not be used to having, and on top of it, confounded by the fact that you're in a high-risk group for COVID. So that's one. Then we have this idea of the guilt that I did something to cause this that I should have prevented. And then the other more powerful emotion that comes with that can be denial of, well, I can't really feel it and I can't really see it, so it doesn't exist.
Sometimes it's you feel so guilty about something that you don't even want to think about feeling guilty about it because you're so sure that you did something bad to cause this. But, and that really leads to a lot of denial and not following through on the medical care that you might need.
So Dr. Pine, do you have any thoughts about how patients can start to empower themselves and work through and process the fear, guilt, anxiety that they might be feeling?
Well, I think, first of all, you have to realize that you couldn't predict this. This happened. It's not your fault. And it's important to get the facts about it, what you should and should not be doing to keep your situation under control.
Dr. Sequeira, any other strategies that you would suggest?
I agree. I think developing... I oftentimes tell the patients, guilt doesn't fix anything. Having to check your sugar, that's important. That's a fact that has to be done to help control your sugars. So try to work on what you can control. Mm-hmm. Try to do as best as you can. But if whatever you have, we have to work with that. And it's not about guilt, and it's not about how could you be eating pizza or whatever. It's like that's what is easiest.
That's what it is. Yeah.
And we just have to work with you. But as long as it's consistent, so then we can make sure where your sugars are consistently controlled as well.
So it sounds like these feelings that patients might be experiencing are common and they're okay. People process these things in different ways. And if you're feeling guilt and it's heightened during the pandemic, that's okay. And we're going to try to help you work through that. But one of the things that we can do, hopefully, to help you work through that is, one, be here to listen as your healthcare provider, come up with a strategy that will be unique to your specific situation. And the best way we can do that is to have honest and open communication. And then the third is to realize that try to be kind to yourself. Don't be too hard on yourself. Pick manageable goals.
There's different ways of adjusting to your situation. Not feel guilty that you can't go to the gym, or you don't have money to do this, or there's like ways to modify your option to keep you safe and healthy.
Right. It doesn't have to be perfect, as long as it's something. Let's work on something, not perfection.
Yeah,
right.
Exactly.
Great. Well, I really want to thank you both for being part of this discussion. Thank you, Dr. Sequeira, for telling us about diabetes and gestational diabetes in the patients. And Dr. Pine, thank you so much for providing insight on how we can try to manage the stress and anxiety better. Appreciate the input. Thank you both.